Okay, so you're right. We refer to the COVID period, which changed very significantly what we actually did at the time, and primary care in particular based its work mainly on telephone consultations. Supported by the community, who were very patient with us, in fact, and have kept away and have listened to the instructions and have been very aware that coming into a healthcare setting can increase your risk of catching the virus or any infection, to be honest. But of course, now we've moved out of that phase. There are many people who now need to see their doctors, or actually would like to see their GPs again, and perhaps haven't seen their GPs since October, November last year, potentially. So we've had a massive increase in demand as we've moved out of the major incident and into our unlock phase. But unfortunately, what's happened with that is it's timed with a period during COVID where we were supplemented very generously by government officers who came in to help us with the demand. And of course, they've had to go back to their jobs as well. So we've now gone to almost a pre-COVID level of staffing with a post-COVID level of demand. And that, of course, has caused a lot of frustration with people who've been really desperate to try and get through. They've found difficulty getting through on phone lines engaged, or 15 people in front of them, and they've needed their repeat prescriptions, or they wanted to see their GP and have a face-to-face. So where we're going with this one is that we are in a transition phase. So we're moving from almost solely telephone consultations into a combination of telephone and face-to-face. One of the key questions has been, why have we not just unlocked and gone back to where we were? And my message really for that is that we are not through the woods with this one in any way, shape or form. It must feel like it to many people who have been in lockdown and then have released, and we walk down Main Street and it almost looks back to normal. We sit on the beaches and everybody's back to normal, but we must remember that the virus is still there. Tanger still is in lockdown. The UK has reported over 60 deaths in the last 24 hours, 45,000 deaths in the UK. The Junta de Andalucía website, which is a public website, has reported 27 cases in Malaga. We must not drop our guard. So we are still in a process where we are trying not to bring people into an at-risk setting, which is primary care or the hospital. So we are providing telephone where possible. We are providing face-to-face, and as of next Monday, we are providing more face-to-face appointments for GPs.
But these face-to-face appointments must be following a telephone consultation, is that right?
Well, in this transition period up till essentially today that we're talking, we've essentially had that. So you would have your telephone consultation first by default, and then on the decision of the doctor, or if you were very insistent or your symptoms warranted it, we would bring you in for a face-to-face. So it's quite interesting, isn't it? So one face-to-face appointment with a GP has now become 2 appointments, really. So of course that's increased our demand. But as of Monday, we're going to increase the number of pure face-to-face contacts with the GP, and that will be at the request of the patient. So if you ask for one, then you will receive.
So people shouldn't just expect to be attended to if they turn up at the primary care centre?
Well, I think I would ask people not to if they can help it. I would ask people to phone first, because you never know what appointment you might need. So it's worth speaking to somebody in the primary care centre to gain some advice as to what would be the best. You may not need to see a GP. You might just need to go to the blood pressure clinic, or, for example, or get a repeat prescription, and that might not need a doctor's appointment. And bear in mind, as I said, we're still in a COVID period. We still have the viral threat. And we are really asking people still to try and keep away from health services. We all remember that we had a cluster of cases in the dental department, for example, and that illustrated very clearly that health services in general are a place of risk of infection. There is a hive of activity going on in the background, but what we're trying to avoid at all costs are packed waiting rooms. And everybody that went to primary care, in particular in the ICC, will remember days when the waiting rooms were packed, standing room only, and you can only imagine the risk that would pose to a virus.
Now, during the lockdown, you were offering a repeat prescription service via email. Is that still happening?
Absolutely. So you can phone the repeat prescription number, which is the 2007 909, or you can email on the prescription repeats with the S at gha.gi. But please bear in mind that there is a bit of a backlog with this one. Lots and lots of people are phoning. We've had a demand which has exceeded the number of people that could deal with the emails and with the telephone calls. But we've actually deployed more staff. We've again been generously given government employees who've helped us or are helping us. We've moved staff from the hospital down into primary care to deal with the backlog. And I've also asked my GPs, who very kindly lent a hand and are processing prescriptions. For example, in the last 3 days, they've processed over 400 repeat prescription requests. So we are catching up on the backlog, but we've just been hit with this post-COVID unlock massive surge in demand that we are dealing with.